Hi, my name is Allison Johnson. I am a Master's of Science Nursing student at Eastern Kentucky University. Today I will be presenting an integrative review as part of NSC 890. The review will focus on evidence-based online educational programs targeted toward parents and the effects of childhood obesity behaviors. Childhood obesity has become a significant health concern throughout the United States, affecting nearly a third of the children across the country. The state of Kentucky alone estimates a baseline of 15.6% of preschool children ages 2 to 5 years old are overweight or obese. A healthy weight and nutrition status is vital to normal growth and development, and potential complications stemming from pediatric obesity may include many chronic disease conditions. Obesity also poses a threat to a child's psychological well-being and may negatively impact self-esteem and body satisfaction. These children may become a target for bullies and be at a greater risk for depression or suicide. Preschool children ages 2 to 5 years old are the focus of this integrative review. It is during this time that lifelong habits such as eating are established and conditions such as obesity may develop. The concept of family-centered care is being embraced as an effective tool in the treatment of pediatric obesity. Researchers point out that a child's family is most responsible for creating a food environment and influencing food preferences, mealtime behaviors, and activity levels. The use of educational programs in non-traditional settings allows health information and education to be tailored specifically to the needs of each patient and their family. However, significant barriers exist in current family-based interventions, such as significant time commitment issues required for face-to-face educational sessions. Therefore, the need for targeting parents as the agents of change for prevention and treatment of childhood obesity, which has been established in previous research, indicates a need for online programs that offer the flexibility for parents to engage in childhood obesity prevention programs. The goal of this review is to examine existing literature on the impact of an evidence-based online educational program targeted toward parents as compared to a face-to-face educational session on improving child behaviors known to prevent childhood obesity in preschool children ages 2 to 5 years within 1 year of implementation. Nola Pender's health promotion model was used as a theoretical framework for this integrative review. Pender's theory believes that individuals may shape their environment by introducing health-enhancing behaviors, and also proposes that prior, inherited, and acquired characteristics affect health-promoting behaviors. Therefore, an educational intervention targeted toward parents could benefit children who may model health-promoting behaviors practiced within their family. A literature search was conducted using databases including CINAHL Complete, Nursing and Allied Health Database, Medline or EBSCO Host Web, and PubMed. Keywords included obesity, pediatric, online, educational program, preschool, and parents. 2 studies were identified and selected for inclusion in the review. Inclusion criteria included Level 2 or Level 3 studies, whether the study examined the proposed intervention, and whether the study demonstrated the positive patient outcome previously identified. In 2016, Nolden and Sharma conducted a randomized controlled trial to evaluate the efficacy of enabling mothers to prevent pediatric obesity through web-based education and reciprocal determinism or empower intervention at 1 year post-intervention follow-up. This intervention was based on social cognitive theory. The control intervention was listed as the Healthy Living Intervention and was a knowledge-based program designed to provide information about the 4 child behaviors to mothers. Treatments for both interventions included 5 modules, with 1 module devoted to each of 4 child behaviors posited to prevent childhood obesity: physical activity, fruit and vegetable consumption, sugar-free beverage intake, screen time, and 1 booster module covering all 4 of these behaviors. A power analysis required a sample size of 42 for detecting statistical effect, and in total 44 participants were retained across all points of measurement. Study findings indicated significant changes in child fruit and vegetable consumption, child sugar-free beverage intake, and child screen time. Significant main effects were not found for child physical activity. Within the control group, significant main effects were found for maternal facilitated child physical activity constructs of expectations, but only the maternal facilitated environment for child fruit and vegetable consumption elicited a significant group by time interaction. Tavares et al. In 2011 conducted a randomized control trial to examine the effectiveness of a primary care-based obesity intervention over the first year of a planned 2-year study. This intervention was based on the chronic care model and was a cluster randomized control trial in 10 primary care pediatric offices. The study enrolled 271 children in the intervention group and 204 in usual care. The independent variable was the High Five for Children program, with dependent variables measured including body mass index, behavioral goals, daily intake of sugar-sweetened beverages, fast food intake, fruit and vegetable intake, and physical activity intake. Study findings indicated that at 1 year, body mass index had increased by a mean of 0.31 in the intervention group and by 0.49 in the the control group. The intervention group decreased screen time more than usual care, except in higher income households, and decreases in fast food intake and sugar-sweetened beverage intake were also noted. Both of these studies included a theory-based online educational module addressing the behaviors believed to prevent childhood obesity. The study conducted by Knowlton and Sharma also evaluated a fact-based online educational module addressing maternal facilitated constructs. Tavares et al. Examined the effects of healthcare system changes such as training and educational medical record updates, disease management visits to a primary care office, and the current standard of care. The results of both of these studies are valuable to the evidence-based practice of advanced nursing. As Hessler in 2015 points out, nurse practitioners are in an ideal position to provide brief educational intervention to parents and children with the goal of promoting health and decreasing the possibility for obesity in each pediatric patient. To reach lasting potential in the fight against pediatric obesity, research suggests coupling evidence-based practice with established treatment guidelines. It is recommended from these studies that practitioners working with populations with reliable internet access consider incorporating web-based components for family home-based interventions, and to apply interventions to practice and accept changes in the roles and responsibilities of the entire practice team, including retraining of clinicians to support family behavior changes.